A stroke is a brain attack. It occurs when blood flow to an area of the brain is cut off. Because of this, that area of the brain begins to die. Persons at risk to get stroke are those with high blood pressure or hypertension, also those with obesity, those with diabetes, high cholesterol, persons who smoke, persons who drink alcohol, or persons that do illicit drugs such as cocaine, also persons with heart disease or persons with an irregular heartbeat. Signs and symptoms of stroke. So when you see a person, you can tell if they're having a stroke, if they have slurring of the speech, twisting of the face, if they have any weakness on one side of the body, such as in the arms or in the legs, if they have difficulty walking, loss of balance, also if they have a sudden loss of vision in one eye or both eye, or sudden blurriness of the vision, also severe headaches associated with vomiting or dizziness. So these are some of the signs and symptoms that we should look out for in persons to know if they're having a stroke. Stroke can be prevented by taking our medications. So those with hypertension or high blood pressure should take those medications to reduce their blood pressure, because strokes are associated with blood pressures greater than 120/80. So we should take our medication to get to that target blood pressure. Also, those with diabetes should take their medication to lower their sugar levels. And so on for those with high cholesterol should do the same. So persons who have a previous stroke should be aware that they're at greater risk for having another stroke, especially if they haven't changed any of those pre-existing conditions such as their hypertension or their high blood sugar levels or their high cholesterol. If they're obese, they should go ahead and try to exercise and diet and lose some weight. So stroke can happen to anyone at any time. Children, however, are at less risk of having a stroke, as stroke affects those over age 50 and above. So children, for instance, those with sickle cell disease or heart conditions such as heart murmurs or a defect in the heart, are at increased risk of getting a stroke. Those with a family history of stroke should look out and prevent those risk factors such as hypertension and diabetes, as if your mother or your father had a stroke in the past, you're at increased risk for having a stroke. So you should go to your physician or your doctor and get checked for hypertension or diabetes or high cholesterol. So having a healthy lifestyle would decrease your risk of having a stroke. So if you exercise regularly, if you eat a well-balanced diet, if you don't smoke, if you don't drink alcohol, then you're reducing your risk of having a stroke.